A 45-year-old woman comes to your clinic for a routine health checkup. She has no significant medical history, but her family has a history of cardiovascular disease and diabetes. Based on current health screening guidelines, which tests should be recommended for her? Discuss the rationale for each recommendation. Answer: for this patient, the recommended screenings would include blood pressure screening. Per the American Heart Association (AHA) guidelines, all adults over 18 should have their blood pressure checked at least every 2 years. This is important for early detection of hypertension, which can increase the risk of heart disease and stroke. Blood glucose testing. Given the family history of diabetes, a fasting blood glucose test or hemoglobin AC test is recommended to screen for type 2 diabetes. The American Diabetes Association (ADA) recommends screening for adults starting at age 45, especially if there are risk factors like a family history of diabetes. Lipid profile, cholesterol screening. A fasting lipid profile is recommended starting at age 45 for women, especially those with a family history of cardiovascular disease. This helps identify high cholesterol levels that could lead to heart disease. Mammogram. In line with guidelines from the U.S. Preventive Services Task Force, women aged 40 to 49 should discuss the potential benefits and risks of starting mammography screening with their healthcare provider. This would help detect breast cancer in its early stages. Colorectal cancer screening. Starting at age 45, adults are advised to undergo colorectal cancer screening. The patient may opt for stool-based tests, e.g., FIT, or visual exams like colonoscopy, depending on individual preferences and risks. Rationale. These screenings are designed to detect early signs of chronic conditions such as cardiovascular disease, diabetes, and cancer. Early detection allows for timely intervention, which can reduce morbidity and mortality associated with these conditions. Describe the role of cognitive behavioral therapy (CBT) in managing major depressive disorder (MDD). How does CBT help address the cognitive distortions associated with MDD? Answer: cognitive behavioral therapy (CBT) is a structured, goal-oriented psychotherapy that helps individuals with major depressive disorder (MDD) by identifying and challenging maladaptive thoughts and behaviors. The process typically involves the following: identifying cognitive distortions. CBT helps patients recognize distorted thinking patterns such as catastrophizing, expecting the worst, overgeneralization, viewing one negative event as a perpetual pattern, and black and white thinking, seeing things as all good or all bad. Cognitive restructuring. Through discussions and exercises, the therapist works with the patient to identify and replace these distorted thoughts with more balanced and realistic ones. For example, replacing the belief "I will never succeed" with "I have had challenges before, but I can overcome them." Behavioral activation. CBT also targets behaviors by encouraging patients to engage in activities that promote positive mood. The therapy includes homework assignments, such as scheduling pleasurable activities or exercises to improve mood and decrease the isolation often seen in depression. Problem-solving skills. CBT teaches problem-solving techniques to deal with difficult situations in a structured way, promoting healthier coping mechanisms. Mr. Thomas, a 34-year-old man, is brought to the emergency department by his family after suicide attempt by overdosing on medications. He is conscious but lethargic. What are the immediate interventions the nurse should perform in this psychiatric emergency? Answer: in this psychiatric emergency, the nurse should perform the following steps. Assess the patient's airway, breathing, and circulation (ACS). The nurse should first assess Mr. Thomas's ACS. This is the priority to ensure that he is not at risk of airway obstruction or respiratory distress due to the overdose. Administer oxygen if necessary and monitor vitals closely. Obtain a suicide risk assessment. Once Mr. Thomas's immediate physical safety is secured, assess the severity of the suicidal ideation. This includes asking direct questions about suicidal thoughts, intent, and plans. A mental status exam should be conducted to evaluate his cognitive function and emotional state. Administer appropriate antidote or medications. Depending on the substance he overdosed on, administer the appropriate antidote if available, e.g. naloxone for opioids. In case of a sedative overdose, activated charcoal may be administered within 1 hour of ingestion if indicated. Ensure the healthcare team is prepared to provide intravenous fluids or medications as necessary. Psychiatric consultation and safety monitoring. Mr. Thomas should be closely monitored for signs of worsening depression or other psychiatric symptoms. A psychiatric consult is necessary to assess the need for inpatient psychiatric care, including crisis stabilization. Consider placing him on suicide precautions. 1. Observation in the hospital setting. Rationale. Immediate intervention in psychiatric emergencies involves addressing both the medical and psychiatric needs. Ensuring physical stabilization is critical, followed by a thorough suicide risk assessment and intervention to prevent further harm. A 70-year-old male patient with hypertension and hyperlipidemia is due for his annual checkup. According to the CDC guidelines, what immunizations should he receive during this visit and why? Answer: for a 70-year-old male patient with hypertension and hyperlipidemia, the following immunizations are recommended. Influenza vaccine. The CDC recommends an annual flu shot for adults 65 years and older to reduce the risk of influenza complications, which can be severe in older adults, especially those with chronic conditions like hypertension. Pneumococcal vaccine. The patient should receive the PPSV vaccine and, if not already done, the PCV vaccine as part of a 2-dose series. This vaccination helps prevent pneumonia, which can be fatal for older adults and those with chronic illnesses like heart disease and diabetes. Shingles vaccine. Zoster vaccine. Adults over 50 are recommended to receive the Shingrix vaccine, which is 90% effective in preventing shingles, a painful condition that becomes more common with age. Tetanus, diphtheria, and pertussis. Tdap vaccine. This is recommended for adults every 10 years. Since the patient is 70 years old, it is essential to ensure the most recent Tdap or TD vaccine has been administered. Hepatitis B vaccine. If not previously vaccinated, a hepatitis B vaccine series may be recommended based on risk factors. What are the key nursing considerations when administering selective serotonin reuptake inhibitors, SRS2, a patient diagnosed with major depressive disorder? Answer: when administering SRS, key nursing considerations include monitor for side effects. SRIs can cause side effects such as nausea, insomnia, sexual dysfunction, and headaches. The nurse should educate the patient about these possible side effects and encourage them to report any severe or persistent symptoms. Assess for suicidal ideation. SRIs have been associated with an increased risk of suicidal thoughts and behaviors, particularly in children, adolescents, and young adults. The nurse should closely monitor the patient, especially during the initial stages of treatment or when the dosage is increased. Assess for serotonin syndrome. Symptoms of serotonin syndrome include agitation, confusion, hyperreflexia, and fever. The nurse should educate the patient on these symptoms and ensure immediate medical attention if they occur. Drug interactions. SRIs can interact with other medications, particularly monoamine oxidase inhibitors, MAO, or other serotonergic drugs, increasing the risk for serotonin syndrome. Adherence and education. Educate the patient on the importance of adhering to the prescribed dosage, even if they start feeling better. SRIs may take several weeks to reach full therapeutic effect, and stopping treatment abruptly can cause withdrawal symptoms. During prenatal care, what are the critical elements of antenatal education, and why is it important for pregnant women to be educated on these aspects? Answer: antenatal education is crucial for preparing expectant mothers for childbirth and postnatal care. Key elements of antenatal education include nutrition and lifestyle modifications, education on a balanced diet including proper weight gain and nutrient intake, e.g. folic acid for fetal development. It's essential to discuss the risks of smoking, alcohol, and drug use during pregnancy. Exercise and physical activity. Safe exercises like walking or swimming help maintain maternal health and prepare the body for labor. The nurse should teach the importance of staying active while avoiding overexertion. Labor and delivery preparation. Providing information about the stages of labor, types of pain management, and potential complications during labor prepares the mother mentally and physically. This includes educating about birth plans and discussing potential interventions such as cesarean sections. Breastfeeding and infant care. Education on the benefits of breastfeeding, proper techniques, and managing common challenges like nipple pain or latching difficulties. Signs of pregnancy complications. Educating the patient about signs of complications such as preeclampsia, gestational diabetes, and preterm labor can help the mother recognize when immediate medical care is needed. Rationale. Antenatal education is critical for improving maternal and fetal outcomes, empowering the mother to make informed decisions and helping her manage potential risks during pregnancy and childbirth. What are the key components of a suicide risk assessment in a psychiatric patient? Why is a thorough suicide risk assessment crucial in nursing practice? Answer: a comprehensive suicide risk assessment should include the following components: identifying suicidal thoughts and intentions. Ask direct questions about suicidal ideation, intent, and plans. For example, have you thought about harming yourself? Or do you have a plan for how you would do it? Assessing the severity of the plan. If the patient has a plan, determine its lethality. For example, whether the patient has access to the means, e.g., firearms, medication overdose, and the specific method of execution. Previous attempts and family history. Inquire about previous suicide attempts or family history of suicide. A history of attempts increases the risk of future suicidal behavior. Protective factors. Identify factors that may reduce suicide risk, such as strong social support, religious beliefs, or a commitment to family. Mental health status. Assess for co-occurring psychiatric disorders, such as depression, schizophrenia, or bipolar disorder, which may increase suicide risk. The nurse should also assess for any cognitive impairments that may hinder the patient's ability to recognize or articulate their thoughts. At the age of 5, a child exhibits clear speech and interest in interacting with peers and the ability to follow multi-step instructions, which developmental milestones would be expected of a typical 5-year-old child. How can these milestones be used to assess the child's cognitive, physical, and psychosocial development? Answer: a 5-year-old child should typically meet the following developmental milestones. Cognitive development. Understand basic time concepts, e.g. yesterday, today, tomorrow. Can count to 10 or more. Understands the difference between right and wrong. Physical development. Can dress and undress independently. Fine motor skills are improving and they can use scissors and draw simple shapes. Balances well on one foot for several seconds. Psychosocial development. Develops friendships and enjoys cooperative play. Shows empathy for others, e.g. comforting a friend who is upset. Begins to understand social rules and conventions, e.g. taking turns in games. What other considerations and potential side effects when using antipsychotic medications in the treatment of schizophrenia, and how can nurses monitor for these effects? Answer: antipsychotic medications are primarily used to treat symptoms of schizophrenia, such as delusions and hallucinations. Key considerations and potential side effects include extrapyramidal symptoms, EPS. These include tremors, rigidity, bradykinesia, and tardive dyskinesia, a late-onset irreversible movement disorder. Nurses should monitor for these signs, particularly in the early stages of treatment. Metabolic syndrome. Antipsychotic medications, especially second-generation antipsychotics, can lead to weight gain, insulin resistance, and dyslipidemia. Nurses should regularly monitor weight, blood glucose, and cholesterol levels. Neuroleptic malignant syndrome, NMS, a rare but potentially life-threatening reaction characterized by fever, muscle rigidity, and autonomic dysfunction. Immediate intervention is required, including discontinuing the antipsychotic and administering supportive care. Sedation. Some antipsychotics may cause significant sedation. Nurses should educate the patient about the risk of drowsiness, especially when performing tasks that require focus, e.g. driving. A 68-year-old male patient with a history of chronic obstructive pulmonary disease (COPD) is admitted to the hospital. What immunizations should he receive during hospitalization, and what factors should influence these decisions? Answer: for this patient with COPD, the following immunizations are recommended. Influenza vaccine. Given the chronic respiratory condition, the flu vaccine is critical in reducing the risk of complications, including exacerbations of COPD. Pneumococcal vaccine. COPD increases the risk of pneumococcal pneumonia. The patient should receive the PPSV vaccine and, if not already vaccinated, the PCV vaccine. Tetanus, diphtheria, and pertussis Tdap vaccine. Although not specifically related to COPD, it's important for adults to receive the Tdap vaccine as part of general preventive care. Hepatitis B vaccine. If not previously vaccinated, hepatitis B vaccination may be considered, especially in patients at higher risk of liver disease due to the impact of COPD treatments. Rationale. These vaccines help prevent respiratory infections and related complications in patients with chronic conditions like COPD. Immunization is an essential part of care for high-risk individuals to reduce morbidity and mortality. A patient with chronic back pain reports that the prescribed opioid medication is not effectively managing their pain. What non-pharmacological strategies should a nurse consider to complement the current pain management plan? Explain the rationale behind each recommendation. Answer: the nurse should consider the following non-pharmacological strategies. Cognitive behavioral therapy (CBT) helps patients change their perception of pain and develop coping strategies. Heat-cold therapy. Application of heat can reduce muscle tension, while cold therapy can reduce inflammation and acute pain. Physical therapy. Regular exercise under supervision may strengthen muscles and improve posture, which can reduce pain intensity. Relaxation techniques. Techniques such as guided imagery and deep breathing can reduce stress, which may exacerbate the perception of pain. Acupuncture or acupressure. These modalities have shown effectiveness in some chronic pain conditions by stimulating endorphin release. These strategies work by addressing the multifaceted nature of pain, including psychological, physical, and environmental factors. The nurse should educate the patient on each technique and assess which methods they feel comfortable using. Explain the physiological complications associated with prolonged immobility and outline nursing interventions that can help prevent each complication. Answer: prolonged immobility can lead to muscle atrophy. Regular range of motion (ROM) exercises and passive movements can maintain muscle tone. Deep vein thrombosis (DVT). Compression devices and encouraging small foot movements can improve circulation and prevent clots. Pressure injuries. Repositioning the patient every 2 hours and using pressure-relieving mattresses are essential in pneumonia. Encouraging deep breathing exercises using incentive spirometry and elevating the head of the bed can help maintain lung function. Constipation. High-fiber diets, adequate hydration, and encouragement of a toileting schedule can support gastrointestinal motility. These interventions help maintain normal body function and prevent immobility-related complications that may prolong hospitalization or require additional treatment. A nurse is caring for a patient with a stage II pressure ulcer on their sacrum. What factors should the nurse assess in determining the wound's healing progress, and what are the appropriate interventions to promote healing? Answer: for a stage II pressure ulcer, the nurse should assess wound size and depth. Documenting any changes over time indicates progress or worsening. Exudate type and amount. Presence of pus may indicate infection, while serous drainage may indicate healing. Tissue appearance. Healthy tissue is pink or red and necrotic tissue is black or yellow. Signs of infection. Redness, heat, and increased pain may suggest infection. Interventions include debridement. Removes necrotic tissue, essential for wound healing. Moist wound healing. Applying moist dressings prevents desiccation and allows new cell growth. Nutritional support. Adequate protein intake is vital for tissue repair. Pressure offloading. Specialized cushions and frequent repositioning reduce pressure on the wound site. These interventions aim to create an optimal healing environment and reduce complications such as infection. Mrs. Gomez, a 70-year-old patient with limited mobility, requires catheterization due to urinary retention. What are the primary infection control practices the nurse should implement to reduce the risk of catheter-associated urinary tract infections, (Cortes) in Mrs. Gomez? Answer: to reduce the risk of Cortes, the nurse should use aseptic technique, ensure hand hygiene and sterile equipment during insertion, limit catheter duration, remove the catheter as soon as possible as extended use increases infection risk. Proper catheter care. Perform daily perineal care. Keep the catheter tubing below bladder level and avoid kinks. Encourage hydration. Promote fluid intake to help flush bacteria from the urinary tract. These practices align with CDC guidelines for catheter care and are critical in minimizing Mrs. Gomez's risk of developing a CAUTI. Describe the major developmental milestones a nurse should expect in a 2-year-old child in terms of motor skills, language, and social interaction. What are some red flags that could indicate developmental delays? Answer: at 2 years old, typical developmental milestones include motor skills, walks up and down stairs, kicks a ball, and can build towers with blocks. Language, vocabulary of 50 words, uses 2-word phrases, and starts using pronouns. Social interaction, begins parallel play and exhibits autonomy. Red flags for developmental delays at this age include motor delays, not walking steadily or showing poor coordination. Language delays, fewer than 50 words and not using 2-word sentences. Social delays, lack of eye contact, no interest in other children, or failure to follow simple commands. Early identification of these signs can prompt referrals for further evaluation and early intervention services. A nurse is assisting a patient with limited mobility in maintaining personal hygiene. Describe the key considerations and safety measures to ensure effective hygiene practices without causing injury to the patient. Answer: when assisting a patient with limited mobility in maintaining personal hygiene, the nurse must prioritize patient safety, comfort, and dignity. Key considerations include ensuring a safe environment by removing obstacles and using supportive equipment such as transfer belts, pillows, or specialized chairs. The nurse should also monitor the patient's skin for signs of breakdown or redness, as immobile patients are more vulnerable to pressure injuries. Water temperature should be checked to ensure it is comfortable, avoiding burns or discomfort. The nurse should use proper body mechanics to avoid injury to both the patient and themselves. The patient should be positioned comfortably and supported to minimize the risk of falls or strain. For patients who are unable to perform hygiene tasks independently, the nurse should encourage participation as much as possible, fostering independence and promoting a sense of dignity. Privacy should be maintained at all times, with only necessary areas exposed. If the patient has incontinence, the nurse should focus on perineal care to prevent skin irritation. Lastly, if the patient is prone to dehydration, the nurse should ensure they have access to fluids during and after hygiene routines. These interventions align with the holistic goal of enhancing patient comfort while preventing injury. Explain the principles of family-centered care in pediatric nursing and discuss how a nurse can support family involvement when a child is admitted to the hospital. Answer: family-centered care in pediatric nursing emphasizes the family's role as an integral part of the child's healthcare team. This approach recognizes that the child's well-being is deeply connected to the family dynamics, and involving the family enhances the overall care experience. The nurse supports family-centered care by fostering open communication, respecting the family's cultural and individual preferences, and providing emotional support. It is crucial for the nurse to educate the family about the child's condition and treatment plan, addressing their concerns and involving them in decision-making processes. Families should be encouraged to participate in care activities such as administering medications, assisting with feeding, or engaging in comforting practices like holding or talking to the child. By providing these opportunities, the nurse empowers parents and caregivers, which improves patient outcomes and reduces anxiety. Additionally, family members should be included in care conferences and given flexibility in visiting hours to ensure they remain closely involved in the child's care. The nurse can also assess the family's coping mechanisms and provide resources or referrals to support their emotional and psychological well-being during the hospitalization. Describe the nursing interventions that should be implemented to manage a patient's pain using a holistic approach. How do these interventions align with the goals of patient-centered care? Answer: holistic pain management is an approach that addresses the physical, emotional, and psychological aspects of pain, aiming to provide comprehensive relief to the patient. The first step is the accurate assessment of the patient's pain using scales such as the Visual Analog Scale (VAS) or Numeric Rating Scale (RS). Pharmacological interventions like opioids, NSAIDs, or acetaminophen are often necessary to manage severe pain, but non-pharmacological strategies should also be integrated. These strategies include relaxation techniques, guided imagery, mindfulness, music therapy, or the application of heat or cold. By combining these methods, nurses can help reduce pain while promoting a sense of control and comfort for the patient. Non-pharmacological interventions have the added benefit of reducing reliance on medications, potentially decreasing side effects like drowsiness or constipation. Emotional support is equally important. Providing empathetic communication and actively listening to the patient's concerns can alleviate distress and anxiety related to pain. Patient-centered care is reflected in this holistic approach by tailoring the pain management plan to the patient's individual preferences, needs, and goals. For example, a patient may prefer non-drug interventions or require education on pain management techniques for use at home. What factors increase the risk of pressure injury in bedridden patients, and what interventions should a nurse prioritize to prevent pressure injuries? Answer: bedridden patients are at a heightened risk for pressure injuries due to immobility, which impedes blood flow to certain areas of the body, particularly over bony prominences like the sacrum, heels, and hips. Other risk factors include poor nutritional status, moisture from incontinence or perspiration, and comorbidities such as diabetes or vascular diseases that impair circulation. The nurse should prioritize several interventions to prevent pressure injuries. First, regular repositioning of the patient at least every 2 hours is essential to relieve pressure on vulnerable areas. A turning schedule should be established and adhered to, using techniques that minimize friction and shear when moving the patient. Pressure-relieving devices such as special mattresses or cushions should be utilized to distribute pressure more evenly. Proper nutrition is crucial for skin health, so ensuring the patient receives adequate hydration and high-protein foods can aid in tissue repair and maintain skin integrity. Skin assessments should be conducted daily to detect early signs of pressure injury, such as redness or skin breakdown. Additionally, keeping the skin dry and moisturized can prevent maceration, which increases the risk of injury. Incontinence care is also important, and nurses should change soiled linens promptly and use barrier creams to protect the skin. Mr. Johnson, a 78-year-old patient with limited mobility, is recovering from a hip replacement surgery. He complains of increasing pain and discomfort when repositioned and expresses concern about pressure injuries. What interventions should the nurse implement to address these issues while promoting Mr. Johnson's comfort and safety? Answer: Mr. Johnson's pain and risk for pressure injuries require immediate attention to ensure his comfort and safety during recovery. The nurse should first assess the source of his pain, determining whether it is related to the surgical site or due to pressure on vulnerable areas. For pain management, the nurse can administer prescribed analgesics, including both pharmacological and non-pharmacological strategies. Non-pharmacological approaches such as repositioning with proper alignment, using pillows or specialized devices to cushion pressure points can help alleviate discomfort. The nurse should also ensure that the repositioning schedule is maintained to reduce the risk of pressure injuries, turning Mr. Johnson every 2 hours while taking care to avoid friction or shear. Using pressure-relieving devices like a foam mattress or air cushions can further reduce the risk of developing pressure injuries. The nurse should conduct a thorough skin assessment and check for signs of early pressure injury, especially over bony prominences such as the sacrum, heels, and hips. Moisture management is critical, so the nurse should monitor for incontinence and use barrier creams if necessary. Mr. Johnson's pain management plan should be individualized, considering his preferences and responses to treatment. What are the key elements of active listening in therapeutic communication, and how would you apply them to de-escalate a tense situation with a patient experiencing an acute anxiety attack in an emergency room setting? Answer: active listening involves giving full attention to the speaker, reflecting on what is being said, and providing verbal or non-verbal feedback that encourages the speaker to continue. The key elements of active listening include restating or paraphrasing, verbalizing the patient's words back to them to show understanding, clarifying, asking open-ended questions to gather more information if needed, non-verbal cues, nodding, maintaining eye contact, and using a calm, empathetic tone. Empathy, acknowledging the patient's feelings without judgment. In a patient with an acute anxiety attack, using these techniques helps the nurse create a calm environment. For example, the nurse might say, "I see that you are feeling overwhelmed right now. Can you tell me more about what you're experiencing?" This helps the patient feel heard and reduces anxiety. A 35-year-old male, Mr. Davis, is diagnosed with bipolar disorder. He presents with symptoms of elevated mood, increased energy, and impulsive behavior. Mr. Davis' treatment plan includes lithium and cognitive behavioral therapy (CBT). As a nurse, how would you assess his response to the medication, and what are the priority interventions to monitor for possible complications with lithium use? Answer: lithium is a mood stabilizer commonly used in the treatment of bipolar disorder. Nurses should monitor for signs of lithium toxicity, as this can lead to severe complications. The therapeutic range for lithium is typically between 0.6 to 1.2 microl. Signs of toxicity include tremors, confusion, nausea, vomiting, and ataxia. Monitoring should include regular blood tests to check lithium levels, kidney function tests, BUN creatinine, as lithium is excreted via the kidneys. Monitoring for signs of dehydration, as this can increase the risk of toxicity. Assessment of vital signs and the patient's mental status. Additionally, providing psychoeducation on recognizing signs of toxicity and the importance of maintaining consistent fluid intake is essential. A 45-year-old male, Mr. Harris, presents with a history of alcohol dependence and is experiencing withdrawal symptoms such as tremors, sweating, and agitation. Which interventions would you prioritize to ensure his safety during detoxification, and what medications might be included in his treatment plan? Answer: alcohol withdrawal can escalate to delirium tremens, DTS, a potentially life-threatening condition. The priority interventions for Mr. Harris would include monitoring vital signs regularly, especially for signs of hypertension, tachycardia, and fever, which are common during withdrawal. Administering benzodiazepines, such as lorazepam or diazepam, to help manage agitation and prevent seizures. Providing IV fluids to correct any dehydration and electrolyte imbalances. Thiamine administration to prevent Wernicke-Korsakoff syndrome, a neurological complication of alcohol withdrawal. Continuous monitoring for signs of severe withdrawal, such as hallucinations, seizures, or DTS. Education on the dangers of alcohol use and the importance of support groups or treatment programs, e.g. Alcoholics Anonymous, would also be part of the long-term care plan. Mrs. Thompson, a 78-year-old terminally ill patient in hospice care, is experiencing significant pain and expresses a desire to die peacefully at home. As her nurse, what are the ethical considerations and interventions that ensure her comfort and autonomy are respected while providing palliative care? Answer: as a nurse in hospice care, respecting patient autonomy and promoting comfort are central tenets. Ethical considerations include respecting the patient's wishes regarding the use of analgesics and other interventions, ensuring that pain management is prioritized even if it may hasten death, the principle of double effect. providing emotional and psychological support to Mrs. Thompson and her family to ensure they understand her treatment goals, which focus on quality of life rather than curative measures, providing education about the dying process, including managing symptoms like nausea, dyspnea, and agitation, consulting with the multidisciplinary team, including chaplains and social workers, to ensure holistic care. The goal is to allow Mrs. Thompson to die with dignity and comfort in line with her expressed preferences. After delivery, Mrs. Williams, a 29-year-old first-time mother, experiences heavy vaginal bleeding and exhibits symptoms of postpartum hemorrhage (PH). What are the initial steps you would take to manage her condition, and what are the possible causes of PPH that should be considered in her assessment? Answer: postpartum hemorrhage (PH) is a medical emergency and requires immediate intervention. The initial steps to manage PPH include massaging the uterus to promote contraction and reduce bleeding, administering uterotonics such as oxytocin to stimulate uterine contractions and reduce blood loss, assessing vital signs, especially blood pressure and heart rate, to monitor for signs of shock, establishing an intravenous Roman relin for fluid resuscitation and blood transfusion if necessary, monitoring for signs of shock such as pale skin, rapid breathing, and a low blood pressure. The causes of PPH include uterine atony, where the uterus fails to contract properly after delivery, trauma to the birth canal, including lacerations or episiotomy, retained placenta, coagulation disorders such as disseminated intravascular coagulation (DIC). During prenatal care, a 32-year-old woman, Ms. Morgan, is informed that her gestational diabetes test results are elevated. What are the possible complications of gestational diabetes for both the mother and the newborn, and how would you educate Ms. Morgan about managing her condition? Answer: gestational diabetes (GD) can lead to complications for both the mother and newborn if not properly managed. For the mother, complications may include hypertension or preeclampsia, increased risk of developing type 2 diabetes later in life, difficult delivery due to macrosomia large baby. For the newborn, complications can include macrosomia, which increases the risk of birth injuries such as shoulder dystocia, hypoglycemia after birth, as the baby's insulin production adjusts to lower blood sugar levels after delivery, respiratory distress syndrome, as high blood sugar can affect lung development. Ms. Morgan should be educated on monitoring blood sugar levels regularly, dietary changes including eating balanced meals with controlled carbohydrate intake, regular physical activity to improve insulin sensitivity, possible medication, insulin if lifestyle changes are insufficient. In the active phase of labor, Mrs. Patel is 7 centimeters dilated and expresses a desire for pain relief. What are the different options for pain management during labor, and what are the risks and benefits of each? Answer: pain management during labor can be pharmacological or non-pharmacological. Common pharmacological options include epidural anesthesia, provides effective pain relief during labor, but it carries risks such as hypotension, spinal headache, and prolonged labor. It can also interfere with mobility during labor. Opioid analgesics, morphine, provides systemic pain relief but may cause drowsiness, nausea, and respiratory depression in the newborn. Nitrous oxide, inhaled gas that provides light sedation, reducing pain perception. It is fast-acting and can be easily controlled by the patient, but it may not be effective for advanced stages of labor. Non-pharmacological options include Lamaze techniques, focusing on controlled breathing to reduce pain perception, position changes, massage, and hydrotherapy to relieve discomfort. A newborn's Apgar score is recorded as 8, 9 at 1 minute and 5 minutes, respectively. What do these scores indicate about the newborn's condition, and what additional assessments should be performed to ensure the baby's well-being? Answer: an Apgar score assesses a newborn's health immediately after birth, focusing on cardiovascular, respiratory, muscle tone, reflexes, and color. A score of 8 at 1 minute and 9 at 5 minutes suggests that the baby is overall healthy but may have had mild initial distress that improved after birth. The Apgar scale assigns 0, 2 points to each of the 5 categories, with a maximum score of 10. A score of 8 indicates that the baby had slight issues at 1 minute, possibly with color or respiratory effort, but these resolved by 5 minutes as shown by the score of 9. Although the baby's Apgar score is generally good, nurses should continue to monitor the newborn's vital signs, including temperature, heart rate, and respiratory rate. Respiratory status should be closely assessed for any signs of distress, e.g. nasal flaring, grunting. Feeding ability should be evaluated, ensuring the baby is able to latch and begin breastfeeding effectively, which can indicate healthy reflexes. Additionally, the skin should be checked for jaundice or any birth trauma. If any abnormal findings are present, further interventions may be needed. A patient, Mrs. Jensen, presents with preeclampsia at 36 weeks of gestation. What interventions would you prioritize in managing a condition, and what are the risks to both the mother and fetus? Answer: preeclampsia is a hypertensive disorder of pregnancy that poses risks to both the mother and fetus. For the mother, complications can include eclampsia, stroke, and organ failure, while the fetus may face risks like preterm birth and intrauterine growth restriction. When a patient like Mrs. Jensen presents with preeclampsia, monitoring blood pressure is a priority as well as ensuring that proteinuria is assessed. The nurse should observe for symptoms of worsening preeclampsia, such as headaches, visual disturbances, or epigastric pain, which indicate escalating severity. Antihypertensive medications, such as labetalol or methyldopa, may be prescribed to control blood pressure. If the condition worsens, early delivery may be necessary to protect the mother and fetus, although this depends on the gestational age and the fetal condition. Seizure precautions should also be implemented in case the preeclampsia progresses to eclampsia. Mrs. Thompson, a 30-year-old woman, delivered a healthy baby 6 hours ago and is now experiencing severe uterine bleeding and tachycardia. What is the most likely cause of her symptoms, and how should you manage this postpartum complication? Answer: postpartum hemorrhage (PH) is the most common cause of severe uterine bleeding and tachycardia within hours of delivery. It often occurs due to uterine atony, where the uterus fails to contract effectively after delivery, leading to excessive bleeding. Management involves uterine massage to stimulate contractions and reduce blood loss. If bleeding persists, medications such as oxytocin or methylagonovane may be given to enhance uterine contraction and reduce hemorrhage. IV fluids should be administered to restore blood volume and correct hypovolemia. Continuous monitoring of vital signs, especially blood pressure, is crucial to assess the patient's response to the interventions and detect signs of shock. If bleeding continues despite these measures, blood transfusion or surgical interventions such as DC dilation and curettage may be needed to control hemorrhage. Early detection and timely interventions are vital in preventing severe complications like shock or organ failure.